Hey everyone, welcome to Smart Course, the go-to place for authoritative information and strategies for special needs and learning disorders, especially ADHD. Today, we are going to help you understand two symptoms of ADHD, SPD, sensory processing disorder, and RSD, Rejection Sensitive Dysphoria, with research-based strategy used and recommended by Understood.org and WebMD. In this video, first, we will define what is SPD and what does it look like on your middle school age child. Second, we'll provide some useful strategies for helping your child who might be dealing with the disorder. In the second half of our video, we will talk about a lesser-known ADHD symptom, RSD, Rejection Sensitive Dysphoria, and the possible signs of such condition. Lastly, we will discuss a few treatment options for your child with RSD. ADHD symptoms like trouble focusing, impulsivity, and hyperactivity are often talked about, but a commonly co-occurring set of symptoms classified as sensory processing disorder are mentioned less. SPD, short for sensory processing disorder, happens when something around us overstimulates one or more of our senses, including touch, sight, hearing, taste, smell, and balance. We have all experienced sensory overload at some point in our life. To some people, for example, loud thunderstorm, the sound of nails against the chalkboard, or slimy and greasy texture give us a feeling of unease and anxiety. But for children with sensory processing issue, the condition can be especially overwhelming and even panic-inducing. SPD is a neurological condition that makes it hard to process and act on information received from the senses. Most children with SPD display symptoms of sensory overload. According to the director of the Sensory Processing Treatment and Research Center, researchers have found that more than half of the children with ADHD might be suffering from the disorder. To children with ADHD who have the condition of SPD, certain noises, smells, or textures heighten their reaction. They might not be able to explain their source of discomfort or anxiety. It might seem that your child is anxious and upset a lot of the time for no good reason. Frequent sensory overload may indicate that your child had a sensory processing condition. Here are a few questions for you to answer to see if your child is exhibiting symptoms of SPD. Is bath time always difficult? Does your child hate being sprayed with water? Or often throw the tantrum when his or her hair got wet? Does your child get extremely bothered by anything sticky or slimy on his or her finger, like paint or glue? Does your child have poor balance and coordination? Do you notice difficulties during exercise like jumping rope or climbing trees? Does your child often spit out foods with particular texture like mushy cut peas or banana pieces and refuse to eat any dishes that contain mushy foods? Does your child refuse to take pictures because camera flashes hurt their eyes? Or does your child get annoyed or angry when you open window blinds? Does your child get irritated when put on sweater or clothes with tags? Do they only wear loose clothes because tighter clothes give them an itchy feeling and makes him uncomfortable? Is your child especially sensitive to scents? Does washing your child's clothes or sheets with scents lead to meltdowns? If you answer yes to at least 4 of the above questions, your child is likely to be experiencing SPD. Symptoms of sensory processing issue might depend on the way in which a child processes sensation. In the case of ADHD, children tend to be hypersensitive. Therefore, they can sometimes react to stimuli as though everything is too loud or too bright. These outsized reactions may cause a low pain threshold, appearing clumsy, fleeing without regard to safety, covering eyes or ears frequently, as well as picky food preference. As parents, it is as much of a challenge to deal with your child's daily upset as it is to see them struggling. Although it is not clear what causes sensory issues in children, what is known can help you understand your child's struggle and provide support. There is no instant solution for SPD. However, you might be able to help your child learn to manage their behavior and gain control with these strategies. First, earn their trust. Children with severe sensory issues often feel out of control and seem to be in a fight or flight mode most of the time. Let your child know that you understand his issues are real and that you are working on a concrete plan to help minimize his stress and sensory overload. This will help your child feel confident that you are in charge and that he is safe and that you will be his support. Second, manage sensory exposure and the environment. If your child has a sensory problem, it is critical to stay ahead of known triggers to minimize anxiety and meltdowns. For kids with hypersensitivity to noise, try to giving them a quiet place at home where they can go when they feel overwhelmed and need a break. If your child has extreme sensitivity to certain types of clothing, go through his wardrobe together to determine which pieces are tolerable and which ones aren't. Another useful strategy is to create a small kit for dealing with sensory problem on the go, so you and your child are always prepared. You might include earplugs for noise and sensory fidgets to keep hands busy. Stay ahead of your child's sensory sensitivity by being prepared can go a long way in minimizing distress. Third, incorporate silence. Your child with SPD may benefit from scheduled silent time. For example, wake your child earlier in the morning to enjoy a favorite activity before school, and make sure your child is quiet and undisturbed. Also, try giving your child at least 30 minutes of quiet time after school to rest and reset. Before bed, allow another 30 minutes of quiet time to unwind. Lastly, if you suspect your child has severe sensory issue, these following signs might indicate that it is time to seek guidance from your healthcare provider. The behavior interrupts everyday life to the point that it is difficult to carry on a normal day. Symptoms become severe suddenly. For example, if your child is suddenly having difficulty standing or moving at all, it is time to see a doctor. Now you know what SPD is and strategies and treatments for SPD. Let's move on and learn about RSD, Rejection Sensitive Dysphoria. So what is Rejection Sensitive Dysphoria? RSD, similar to SPD, is a condition that is characterized by hypersensitivity to negative emotions, and in particular rejection and criticism. Many people who have ADHD have a heightened sensitivity to what other people think or say about them. Children with RSD don't handle rejection well. They often get very upset if they think someone has rejected or criticized them, even if that's not the case. Up to 99% of teens and adults with ADHD are more sensitive than usual to rejection. And nearly 1 in 3 say that it is the hardest part of living with ADHD. How can RSD affect your child's life? Children who have the condition sometimes work hard to make everyone like and admire them. Or they may stop trying and stay out of any situation where they may get hurt. RSD can also affect relationships with family and friends because the belief that they are being rejected can turn into a self-fulfilling prophecy. When you act differently toward the person you think has rejected you, they may begin to do so for real. Look out for the following signs to determine whether your child has RSD. Children with RSD may be easily embarrassed, get very angry, or have an emotional outburst when they feel like someone has hurt or rejected them. Set high standards for themselves they often can't meet. Have low self-esteem and feel anxious in social settings. Have problems with relationships. Stay away from social situations and withdrawn from other people. Feel like a failure because they haven't lived up to other people's expectations. Sometimes think about hurting themselves. Some of these symptoms are also common in other mental health conditions, such as bipolar disorder, borderline personality disorder, PTSD, depression, and social phobia. One difference is that RSD episodes are intense but don't last very long. Because RSD can look like other mental health issues, it is important to get the right diagnosis. If your child had any of these symptoms, see a psychologist, counselor, or other mental health provider for help. Everyone has good days and bad days, so having an occasional outburst or emotional response doesn't mean that your child needs to see a doctor. You should, however, make a doctor appointment if you notice your child has worsened, overwhelming feelings of hurt and anxiety or rage. Medical intervention is especially necessary when RSD starts to have an impact on the quality of your child's daily life. Now that we know what RSD is and what are the signs of the condition, let's discuss some effective behavioral strategies to help with these issues. First, help your child see different perspectives. If a friend can't come over because he's playing with someone else, your child may see it as rejection. Help your child understand that sometimes things just happen. Maybe another kid got first. It doesn't mean the friend doesn't like him anymore. Second, share stories about experiencing rejection in the past and how you or someone else got over it. You can tell stories about famous people getting rejected and overcoming rejection. For example, Michael Jordan was cut from the high school basketball team. J.K. Rowling was rejected by 12 publishers for her first book of the Harry Potter series. You can also share your own experience of being rejected and what you did to get over it. Third, build resilience in your child. Help your child come up with a plan to move forward. For example, if your child isn't chosen for baseball, explore another activity to focus on together. If he still wants to pursue baseball, develop a concrete practice schedule to improve. If your child's friend cancels plans, brainstorm who else could come over. These kinds of coping strategies will make your child emotionally stronger and more resilient when faced with setbacks in the future. Lastly, remain hopeful and understand that RSD is definitely not uncommon for children with ADHD, and you are not alone. With the right strategies and early intervention, your child can successfully manage their emotions in the face of rejection and failure. In our upcoming video, we will be discussing ADHD and impulsivity, forgetfulness, and fatigue. For an expert-curated list of resources from our past summit and videos, in particular, Understood.org, ADHD and Coping with Rejection, What You Need to Know, please visit the link in the description. To make sure you are as prepared as you can be, I want you to hit the notification bell below and join our newsletter, because we'll be sharing much more resources on how to help your family cope better with ADHD, both at school and at home. If you like this video, please don't forget to like it and let us know what you like or what you'd like to see more of in the comments below. The more people like, subscribe, click the bell and comment, the more people will see this kind of content, and we know some people could really use the help. If you haven't watched our previous series about ADHD and other disorder, click the annotation on the top right of your screen to watch those videos. We'll be sharing information about upcoming videos on this YouTube channel and exclusive deals in our newsletter. So again, hit the notification bell and subscribe button under this video and sign up for our newsletter using the link in the description to get early access to and exclusive deals on our resources. For even more specific information, step-by-step guides, and access to a professional who can help you through this process, please sign up for our online course or upcoming summit in August using the links in the description. We share tons of expert-vetted resources on parenting and education for differently able kids, just like kids with ADHD. So make sure to check out our previous video and subscribe to our channel to receive notifications for videos to come. As always, I appreciate you taking the time. Thank you for watching and see you soon.